I'm very honored to be with you today and with the excellent team. So we are going to talk today about the part which is the epidemiological part of VKC. So is VKC really a rare disease, or just because we have limited epidemiological data? As we know, VKC is part of the allergic conjunctivitis group of diseases, which is alone. The allergic conjunctivitis are estimated worldwide to have a prevalence of 6 to 30% among the whole population. But among children, it is 30%. And with a solid number, it's a high number among children, as you can see. And it can be coming alone or associated with other allergic conditions like allergic rhinitis mainly. And these conditions are variable. We have many allergic conditions to be associated with the VKC. So VKC is really underdiagnosed and underrecognized ocular surface disease. We have a prevalence which is relatively unknown. We don't have real numbers which we can say that we are sure of. The current estimate is always inaccurate, coming with different publishments and papers with different numbers, which is really having high variability. Why is that? First, we have to admit that many cases will not come to the physicians as the disease is self-limiting. Generally, the condition is mild. The symptoms sometimes variable. There are cross-diagnosis and over and misdiagnosis of VKC with other ocular allergies, which is usually is the main obstacle which is facing the practitioners to diagnose and give a correct, accurate statistics. So we will go to the prevalence among the world, which is variable a lot from one area to another, depending on the geographical and the climate among the whole world. And it is really variable even among the same continent. The prevalence of VKC is showing that it is more frequent in Asia, Central and West Africa, and South America. We have nice statistics from Japan, 1.2%. In Africa, it's variable from 4 to 11.1. We don't know, is this because of the wrong statistics, or it is really variable because of the climate. It's a big continent from North to South Africa. And we also have common spread of the disease among the Mediterranean area, North America, Australia, and the overall estimate prevalence in Europe, which is one of the solid statistics, coming 3.2 per 10,000 population. And even we have some more sophisticated, detailed statistics about the corneal complications. Among those 3.2, which is 0.8 having corneal complication in per 10,000 population. Still in Europe, we have Italy with a high percentage of 27.8 per 10,000, while in Norway it is coming down to 1.9 per 10,000. So if we will go for why this is happening, the demographical factors and the clinical patterns of VKC, the demographic factors which we are facing is definitely the onset of the disease is early, from 5 to 10 years old. This is subsiding, the symptoms will subside around puberty, so it is starting somehow early in life and finishing early as well around the puberty time. So pediatric ophthalmologists will be one of the main players, of course, facing and seeing the patients of VKC. VKC is more common in boys than girls, 3 to 1, but this prevalence is changing, getting more close to each other if the onset of the disease will start later in life, the ratio will be less than that. VKC is really as an allergic condition of the eye, strongly associated with other allergic conditions such as eczema, bronchial asthma, allergic rhinitis, as we mentioned before. But still, although we have 50% of patients showing atopic sensation, we still have 50% other than those having ocular manifestations alone. So we have 50% of cases who are coming with their ocular symptoms without any other allergic conditions all over the body. We will talk about AKC, which is going to be covered with our colleagues in details, but AKC is one of the main reasons that the prevalence of VKC is underestimated. And this is because probably the misdiagnosis and the cross-diagnosis with the other types of ocular allergies. Why that? Although VKC is having its symptoms and signs, which they will talk of, my colleagues will talk in details, but AKC is starting older and regressing late. So it is starting late and regressing late, and this is a big difference. And also it's always associated with atopic history, such as facial atopic dermatitis, which is one of the mandatory presence of the ocular, the systemic manifestations. So it is a big differentiation point. The role of environmental factors in the development of VKC is very important. And you know, the warm weather, dry, windy climates are definitely playing a big role in worsening and increasing the severity of the symptoms of VKC. And this is maybe because of the air pollution, Asian dust storms, and it is more common during pollen seasons. This is why the severity is increasing during the spring-summer period. But still, it can occur all over the year. Again, like in some areas of the world, it is maybe because of the indoor allergen or the dust mites could be responsible for the all over affection of